All right, let's talk about that really intense, sometimes scary feeling of breathlessness that can come with COPD. We're going to peel back the layers on why it happens, and we'll be diving deep into something called dynamic hyperinflation, which, it turns out, is the real culprit behind what's known as air hunger. So, let's just start with the question that I think gets right to the heart of it all. How is it that something as basic as walking up a flight of stairs can feel like you've just run a marathon? It's a super common experience for folks with COPD. And the answer, you'll see, isn't just about being out of shape. Nope, it's a very specific, very mechanical problem happening inside the lungs. So let's just focus on that feeling for a second. It's often called air hunger, which is such a powerful way to put it, right? It's that terrifying feeling where you just can't get a deep, satisfying breath in, no matter how hard you try. Well, it turns out there's a name for the process that's causing all of this. And that name is dynamic hyperinflation. Now, if there's one phrase you should lock on to here, it's time dependent. That is absolutely crucial, because what it means is this isn't some permanent state. It's a situation where air gets trapped inside your lungs for one simple reason. There just isn't enough time to get it all out before you need to take your next breath. Let's break down exactly why that happens. Okay, so to really, truly get a handle on dynamic hyperinflation, first we have to understand the place where it's all happening, the COPD lung itself. What is it about these lungs that makes getting air out, not in, but out, such a challenge? To make this super clear, let's use an analogy. I think this will really help. Imagine your lungs are a sink. Simple enough. When you inhale, it's like turning on the faucet and filling that sink with water. And when you exhale, that's the drain, letting all the water out. Makes sense, right? But what happens if that drain starts to get clogged? And this slide right here, this gets to the absolute core of the problem. Over on the left, you've got healthy lungs. They have what's called a high elastic recoil. They're really springy, they snap back and push air out easily through these nice, wide open airways. That's a sink that drains in a flash. But then you look to the right at COPD lungs. That springiness, it's gone, and the airways are narrowed. This is our slow-draining, partially clogged sink. Air just can't get out nearly as fast. Okay, so we've got our slow-draining sink. What happens when you suddenly need to use it way more often and way more quickly? Well, that brings us to the air-trapping cascade. This is the step-by-step chain reaction that leads directly to that awful feeling of air hunger. And it all starts with a simple trigger. Anything that makes you need to breathe more. Exercise, sure, but also maybe some anxiety or a flare-up. In our sink analogy, this is like cranking that faucet on full blast and doing it over and over. You're trying to fill and empty that sink way faster than usual. And this is where that chain reaction just kicks right in. First, your body's demanding more air, so naturally you start breathing faster. But here's the catch. Because you're breathing faster, you have less time for each breath, especially less time to exhale. And here's the critical part. That slow, clogged drain of a lung just can't empty in that tiny window of time. So what happens? With the next breath, a little more air gets left behind, and then a little more with the next and the next. It just keeps accumulating, breath after breath after breath. And this isn't just a theory. This chart shows you exactly what it looks like with real numbers. Just look at this. At rest, the lung might hold around 3 liters of air after a normal exhale. But during something as simple as a brisk walk, all that trapped air can cause the volume to swell to over 4.2 liters. That's more than a full liter of extra stale air trapped in the lungs, literally overinflating them like a balloon. So, okay, the lungs are overfilled with stale air. So what? What does that actually do to your body? Well, this overinflation, it has some pretty serious consequences that are the direct cause of that breathlessness we've been talking about. All that trapped air creates something called auto-PEEP. Now, PEEP stands for positive end expiratory pressure. Fancy term, but what it means is simple. Because the lungs haven't fully emptied, there's still pressure inside them even after you think you've finished breathing out. It's kind of like trying to blow more air into a balloon that's already half full. There's resistance. And this creates what I like to call a hidden hurdle. Before you can even begin to take a new breath in, your breathing muscles have to work extra hard just to overcome that leftover pressure. They have to fight against this auto-PEEP just to get back to the starting line. Just think about that for a second. It's a massive waste of precious energy just to get back to zero. And as you can see here, that wasted effort has a real snowball effect. It leads to this huge increase in the work of breathing. Your main breathing muscle, the diaphragm, gets flattened out by those overinflated lungs, making it weak and really inefficient. All of this just piles on to worsen that feeling of dyspnea, that air hunger. And it can even mess with the crucial exchange of oxygen and carbon dioxide. Now, it's really important we make a quick distinction here, so stick with me. Everything we've been talking about is dynamic hyperinflation. It's acute, it's reversible, and it happens during exertion. This is totally different from static hyperinflation, which is more of a chronic, baseline level of air chopping that's caused by the long-term structural damage from something like emphysema. So this dynamic process we're exploring, it happens right on top of that baseline.
Okay, so we understand the problem, and I know it sounds kind of bleak. But here's the really, really good news. Because this is a dynamic process, it can be managed. It can be fought. So let's look at how we can fight back and actually break this cycle.
You know, one of the most powerful tools is something patients can do all by themselves. It's called pursed lip breathing. It's as simple as breathing in through your nose and then breathing out very slowly through pursed lips, like you're blowing out a candle. It does two critical things. It gives you more time to exhale, and it creates a little bit of back pressure that helps prop those floppy airways open, letting more of that trapped air finally escape. It's like you're manually helping that slow sink drain itself out. And that's not the only tool in the toolbox, not by a long shot. Bronchodilator medications can work to open up those narrowed airways, basically making the drain wider. Pulmonary rehab is amazing for training your body to be more efficient with oxygen. And of course, treating flare-ups and the inflammation that causes them is key. But the most important thing to take away from all this is simple. This cycle can be broken. So we'll end with this question to think about. Now that we've pulled back the curtain on this breath-by-breath cycle of air trapping, how can this knowledge, this understanding, empower patients and their caregivers to recognize it, to manage it, and ultimately to break that vicious cycle of air hunger? Thanks for joining me for this explainer.